emergencies can happen at any time. And so, and in fact, that is what happened to us. And so we had set this up in August, even though we had primary health care in the States, because you just never know when something's going to happen.
We're both members of Rotary Club here in Chapala. However, we met Dr. Hernandez through the Ajijic Rotary Club, and we liked the fact that he was a Rotarian. He had the people that we talked to felt he was a good doctor, and he was local, which was a big thing for us. I had a major event with my back, which led to an event with my heart, and it was an emergency action, and we needed prompt, we needed to have action without delay. And Barb was the primary caretaker, so at this point I'd rather have her discuss my accident and what happened, because I don't remember 2 weeks of it.
He was in writhing pain. We couldn't determine the cause because it was not localized. It was somewhere in his upper body area, but they weren't exactly sure what was causing it. And that's Dr. Santiago ordered an X-ray. There was a serious back issue that needed immediate surgery. So he was in the hospital for, I think, 9 or 10 days with back issues. During that time, there was some concern. His blood pressure skyrocketed during surgery. They weren't sure why. They had to bring it down. Then they got him stable and they completed the surgery. But we came home and we were here for 4 days, obviously recovering from surgery and a lot of pain. But the pain in his stomach, it seemed like, kept getting worse, which was odd. And so we called Dr. Santiago one evening, and after being here 4 days, and we said, he's got this pain, it's going up to his chest, and I'm not sure if that's just a side effect of the surgery. He said, go to the Red Cross right now and get an EKG, which we did. And sure enough, the Red Cross did the EKG right away. They called him so they could confer, and his heart was irregular. And so we went back to the hospital that evening and met with a cardiologist, who then started care and did more tests and found that he had a blockage in one of his arteries, which required a stent. So we were in the hospital then another 8 days.
He had visited us at least 5 times here in our home, and would come after work and spend anywhere from 45 minutes to an hour with us discussing issues.
He gave us his personal cell phone number and encouraged us to call him at any time, and frankly, I did. There were things that would come up for Bill literally at 2 o'clock in the morning. He'd be in really bad pain, and I'd think, what should I do? Or when I was in the hospital staying with him, the nurse would show up with some medication that I hadn't heard of before, wanted to make sure he was getting the right med. Again, I'd call him. And there just was never any hesitation about that, and just call me at any time was the attitude. I think was a really crowning point for me on all of his care was Bill's first night out after we were home. We were going to one of the many charity events here in town. He's like, oh, I'm not sure he's ready. And he came by before we went out to check on Bill, put us into the taxi. And I said, I promise we're only going to stay for an hour and we'll have the taxi wait. He says, okay. So we did that. We went for an hour. We came back by taxi, and we got home about 7 o'clock at night. At 9:30, I got a call from him saying, how did he do? I mean, to me, to send us off to his first event out, and to check up later to see how he done. That, I mean, was just unheard
It's
of. I've
incredible.
never heard of anything like that from a doctor. One of the primary reasons for choosing Dr. Santiago as compared to there's many good physicians in the area, is that he had a foot and a comfort in both countries. Both were from the United States, both in the United States where he had grown up, he practiced there for several years, as well as being of Mexican heritage, completely bilingual, and having gone to medical school and practiced here. So for our lifestyle, which is being in both places, it was really nice, always nice, even before Bill had issues, to be able to talk about the differences. For example, if he was going to author or recommend a test in the States, he would know what they called it there, for example.
I can't say that I've had poor care in the United States, but I've had excellent care here in Mexico. So I just can't say, from our point of view, going through private doctors and knowing that we were going into a first-class hospital and what we did get out of it, that whole experience left a good feeling to us, a good, secure feeling about the future. Based on this experience, I think we both have complete peace of mind as far as the care goes. We never know what will happen. We hope we don't get any major events from now on. I broke my wrist a couple of years ago, so we're getting tired of these events, especially me, from a victim's point and patient point, and her from a caretaker point. So it's really nice to live life this past week as we lived it before, and we hope to continue that.